Hi, everyone. Welcome to Arizona Oral Health Coalition's bite-sized webinar series. My name is Brianna, and I am the coordinator for the Arizona Oral Health Coalition.
Hi, everyone. Welcome back. My name is Tara. I'm the chair of the Arizona Oral Health Coalition Public Awareness Committee. I'm glad to be here today to present this bite-sized webinar. Our bite-sized webinar series consists of short webinars featuring the outstanding work of individuals who work towards oral health equity. This October, we're pleased to host a special series of bite-sized webinars that focus on dental hygiene and medical integration. Today, in the second webinar of the series, we welcome Lori Clark, a dental hygienist with Dignity Health. So welcome, Lori. Thanks for joining us today.
Oh, thank you for having me. I'm really excited about this.
And we are super excited to hear everything you have to say. So would you be able to start us off by telling us a little bit about yourself and the program that you work with?
I sure will. Let's see if we can advance this slide here. There we go. Hang on. My name is Lori Clark. I have been a pediatric dental hygienist for 38 years. My population that I work with and have for my whole career is babies all the way through teens and special needs. I got through dental hygiene school and I realized that I really didn't like dental hygiene. And so I stepped back and really take a look at what pieces that I did like. And I found out that I loved children. And so that's how my career took off with pediatrics. Now, I have done a lot of private practice working for pedodontists. And I've done a lot of public health. I used to work for the Sealant program with Maricopa County, and I did that for 9 years, and I loved that job, working on portable equipment and second and sixth graders in low-income areas of Maricopa County. It was one of my most fulfilling jobs. So now I am with First Teeth First, and I don't know if any of you have heard of First Teeth First, but it is part of the First Things First proposition that was voted in 2008 or 9. And it earmarks all of the tobacco tax in Arizona for early childhood education and health programs. And I just want to let you know, within First Things First, it is all children, all. Doesn't matter where they live, how much money they make, it's all children, 0 through 5, and expectant mothers. Now, the whole purpose for First Things First with all of this tobacco tax is to get our Arizona kindergartners ready emotionally, socially healthy for kindergarten. So just so you all understand what the First Teeth First, where it comes from, it's funded, grant funded by First Things First. So we are funded mostly by First Things First, but we are sponsored by a hospital system called Dignity Health, and we're actually out of Chandler Regional Medical Center. And let me tell you, when we talk about medical dental integration, how blessed have we been to have this program within a hospital system. We are able to utilize a lot of the benefits of a hospital, and we're going to talk a little bit more about those benefits in just a few minutes. But I do want to say that it has been a wonderful experience, and I have been with this program for 11 years. So who do we work with and what do we do? It's kind of a different program to wrap your head around. So what we do is we are out in the community. We do not have a brick and mortar building. So every day I go to a different location. And at that location, I'm working on babies, toddlers, and preschoolers. And so what services do we give these children? We do an oral screening. We can apply fluoride varnish if it's indicated. We do a lot of anticipatory guidance. We do a caries risk assessment. We also do referral and navigation. And that piece I'm really excited about, because what we do is we actually, if there's time in our encounter, my promotora will pick up the telephone and actually hook up a child that hasn't started the dentist, maybe a 1-year-old or somebody that hasn't been going recently, and they're There's a lot of them due to COVID that haven't been keeping up, but we'll make those appointments on site. And the last piece of our program is the care coordination. And that back is in an office setting where we do follow-up and we're helping these families get to appointments.
Lori, I have a question.
Yes,
what is
please.
anticipatory guidance for some of us who aren't as familiar with oral hygiene practice?
I'm so glad you asked. Brianna, it is our teaching. It's our oral health teaching. We teach mamas how to brush, how to wipe gums, nutritional counseling. We talk a lot about sugar. We talk about going to bed with bottles when babies have upper front teeth in. So our anticipatory guidance is the teaching or the home care teaching that we would like our families to practice at home. Did that help answer that?
Yes, wonderful. Thank you.
Mhm. Okay. Now, not only are we with this little population, but we also service our expectant mothers across Maricopa, Maricopa County and statewide. So what do we do with the expectant mother? We will do a basic oral cancer screening, checking for lumps and bumps. We will look in the mouth and we will check those teeth. Again, anticipatory guidance or oral health instruction. We'll do a risk assessment. And you guys, when I talk about risk assessment, we're looking at the things that would put this family at risk for getting gum disease or cavities. And sometimes you'll hear us call cavities caries. Those words are interchangeable. So when we're doing this risk assessment, what us hygienists are doing in our head is we're taking in all this information they've given us on their health history form. And with our motivational interviewing, we are creating a plan and a strategy to lower those risk factors and increase protective factors. So what are protective factors? Well, first of all, let's say, what is a risk? Let's say we have a lot of white spots, and white spots are pre-cavities. Well, we would talk about as a protective factor, the value and the benefit of fluoride in toothpaste, or going to the dentist and have your professional cleaning and the toothpaste applied there. So it's kind of, as we're defining these different items on here, that's what the risk assessment is. And we roll that into our motivational interviewing, because at the end of our appointment, whether it's with the mom with children or our expectant mother, we are going to set an oral health goal for the family. And we let that mother choose that. And sometimes it's overwhelming because I've covered a lot of information. So what I will do is I'll say, well, Mom, you asked me a lot of questions about how often to brush today. Or you have asked, how do I get them to the dentist and how often? Or maybe you haven't started brushing the baby's teeth at all yet. I'll say, these were some of the topics we talked about. So would you like to pick something from that? So I will prompt them a little bit with the motivational interviewing, because it is a little overwhelming with the amount of information we're trying to give the parent. And especially if we have a baby crying or toddlers tugging at them.
Imagine. Lori,
Yeah.
why is oral health so important for expecting moms?
I'm so glad you asked that one too. Let's go into our next segment. And before I answer that, can I just talk about our locations and logistics?
Absolutely.
Where do we go? And this is important for our talk today. The locations that we are currently able to service are preschools. We're in 3 different pediatrician practices, and they have different locations. And we are at health fairs, and we're at federally qualified healthcare centers. Now, prior to COVID, and this is key, we were able to be at WIC clinics in the East Valley, and we worked with some OB offices. But now, since COVID, since March of 2020, we haven't been able to go to those. And I want you to remember that, because that's one of our challenges. Now, logistics, we're completely mobile, and we work throughout the East Valley, except for Maricopa, or except for Scottsdale. We bring our own supplies and equipment. So when we go to a pediatric office, a pediatrician's office, we bring everything with us. And we will focus on locations of high need. Okay, now, Brianna, I get to answer your next question. Oh, I want to just say this is kind of what it looks like, because now this is a pediatrician's office. This is me screening. This is a little Downs baby, and you can't see it, but this baby actually even has a feeding tube and oxygen on and off. So we in the pediatrician's office will work with some pretty medically compromised patients. And in the other picture, that is my promotora, my promoter of health. And she is, she's an interpreter. She has interpreting skills as well. And so when I finish up with teaching and goal setting, the promotora is the one who will talk about, okay, this is the type of insurance that you have or you don't have. These are the resources that come up for you, that I have written up for you. And these are some suggestions of places that we would recommend in your area. I've given you 3. What would you like to choose, Mom? And then she will actually pick up the phone and make that appointment if time allows. So I just wanted you to kind of see this. And on the screening, that is an exam table at a pediatrician's office. So the pediatrician, or if we used to be at the OB office, the provider has already come in and done their examination. So now us, the dental team, would come in after those medical services are completed. Does that make sense, ladies?
Yes, it does. That's a wonderful coordination.
Yeah, yep. Now, moving on to those expectant mothers. Brianna, you asked, why is it important? Well, oh my goodness, all of our research is strongly suggesting that there is a link between the mouth and the body. Who knew? And that's like, who knew? Well, of course, our mouth is taking in this food. It's a huge container for bacteria. It can go through the bloodstream. It gets in the body and creates inflammation. So especially with our pregnant women, these are some of the links that we have: the preeclampsia, the high blood pressure, low birth weight babies, preterm deliveries, complications with deliveries. And through all of that, that is a huge increase of our overall healthcare costs. So not only are we looking at this is mostly through gum disease or periodontal disease, but what about untreated cavities in the mouth? Untreated cavities in our mouth. Our public does not know that us caregivers, us mommies and daddies, we transfer our cavity bacteria to our children in their toddler ages. We can infect them with our cavity bacteria and start the cycle for our children. And when I'm doing that anticipatory guidance or that home care instruction, there are very, very few parents that know that it's infectious or that it's even a disease. So we do worry about the untreated decay as well for our families. Now, you guys, when I read this blew my mind. More than 6,000, no, this is 2014, out of 87,000 live births in Arizona, 6,000 of those were low birth weight babies, 7 out of 10 preterm babies. Now, you can't tell me that that doesn't put a strain on our healthcare costs or complications. So anyway, it's so important. Questions for me, Brianna?
I actually have a question, if I may.
Yes, Tara.
Yeah, you've definitely provided a lot of information about how important these services are for, improving oral health and overall health. But I'm wondering, how did COVID impact your services?
Oh my goodness, it's been challenging. Now today, I'm not going to focus so much on children. I'll talk a little bit about that, but I want to really focus on the expectant mothers. And I want to do that for a couple reasons. First of all, we do not have any places to send our low social economic mothers. So in Arizona, we have a huge barrier to oral health care for this group of women and adults, period. So I want to focus because we lack resources in our state to keep this population healthy. So let's talk about what COVID did on top of the challenges. Our expectant mothers are afraid to leave their houses. They want to stay home. They don't want to be at the grocery store. They don't want to be out in public. They are staying home. Therefore, we are not, in our program, we're not encountering as many of our pregnant moms as we would like to see. So what other challenges? They're not allowing visitors at the OB offices. So our program can no longer go in and help service these women at the practices. And our big one is WIC is doing its services through online Zoom platform. We got the majority of this segment of our population through WIC, and it's been very difficult to find those women now. And then reaching out and trying to find them has been a huge challenge. Now, many of our pregnant mommies are really cautious about getting the vaccine. So there are a lot of barriers that have been brought about through COVID-19.
Wow, yeah, that definitely sounds like such a challenge, particularly when we're talking about pregnant and expectant mothers. Have you found that teledentistry boosts your ability to provide services and reach these people?
Well, Brianna, I have to say that teledentistry has been a godsend to our program. We realized really early on that we were going to need to reach out to our families in through a different medium besides in person. And my manager, Dr. Michelle Gross-Panico, she was able to leverage the benefits of some of the tools the hospital had. So do you remember when I went back and I said there would be more to come about the benefits of working for a hospital? Dr. Panico was able to go through legal and get our Zoom and DocuSign set up. And you guys, this wasn't an easy task going through a large organization. So we use DocuSign, we're using the Zoom platform, and behind the scenes, from an administrator's point, there was a lot to this and a lot of research that went into this. But I can say it has been extremely successful for our pregnant women, and we have been doing it for over a year. Now, where are we finding these patients? Where are we recruiting them to even get them to schedule with us for teledentistry? We are getting them primarily through, and this is another benefit of the medical dental integration working through the hospital. We have always had an excellent relationship with Community Education of Dignity Health. And they, in the past, when we saw patients in person, they would allow us to attend in person and be a part of the childbirth prep classes. Now, in my day and age, it was called Lamaze, but the term now is childbirth prep. And they would allow us to come and do a 5 to 10 minute quick presentation. And then in person, we would go behind the classroom and set up a little area, a private area, and do a quick screening, oral health screening on each one of the pregnant women. Well, we can't do that anymore because all of those meetings like WIC are set up on Zoom. So what we do now is we are on the first part of the Zoom meeting, and you can see that picture there. That's the part of our quick PowerPoint presentation that we provide. It's got six quick slides. And then after, we say for anybody that would like to have a screening, a private screening, so we can find out what your risk factors are in your family and strategize what to do for great oral health. After our appointment, we will send you a pack of diapers, and you will get a spin toothbrush And then we have all of the little things that we give for the babies, like maybe a finger toothbrush. So we send that out as incentive to get them on for those. Now, we've gotten some referrals from pregnancy agencies, some from OB, and some from WIC. But there is a problem with this. We're happy to service this group of women, but the majority of women that we are getting through the childbirth prep now due to COVID are middle-class women. And we need to work harder at finding our low-income mommies that need us. And we got the majority of those through WIC before. So we're really partnering with our WIC people, those key people, to start getting those numbers up. And we would love suggestions if anybody has a way to reach out to us and let us know of any ideas of how we can do that. We're always open to suggestions. So this is what our Zoom flyer looks like. We wanted to make sure that we showed it on the laptop, a tablet or iPad, and a phone. So we give our families lots of choices on how to do this. And we do it through DocuSign and Zoom. We use laptops, hotspots, visual aids. Now remember, we're a mobile program, so many times a mom can't do a specific time. So maybe I'm at a pediatrician's office and it's really an important visit. I may slide off into one of the offices and do a teledentistry appointment. And I have to tell you, the teledentistry for the pregnant women has been phenomenal in the sense that they take notes while I'm going. They all take notes. I'm blown away at how engaged they are. And you would think that you don't need a half hour to talk about oral health, but I go through mom's oral health and then I talk about what to do with baby. And then I am so excited about this. They'll go, oh my gosh, I'm not going to remember all this. And they're also focused on delivery and it's their first baby. I say, you know what? How about we put you on recall and we meet with you again when the baby's about 6 months old, about the time they're starting to get teeth in. And they're like, oh my gosh, please do that. And now we're at the point where we're starting to do our recalls. We're getting the babies in. And I just get goosebumps over that because that's just exciting then to see it go full circle. So you guys, the components of the visit, whether I see a pregnant mom in person or Zoom, is primarily the same. We're going to capture the risk assessment through the DocuSign that comes in. They're going to talk about the risk factors. We're going to talk about those too. I'm going to screen the best I can. You know, I show them, I get up there. Now you guys, I get up there and I show them how to lift their lip and how to get right up to the camera. And we got to work around the lighting and we do the best we can. But you've got to remember in this program, we don't need to know that it's the DO on number 3, it's the blah, blah, blah. In this program, we're going to write generalities down because we're going to hook them up to their dental home and the dental home is going to take care of that. So my whole goal is to get to the pinnacle of the pyramid, which is to get that appointment made. And then through care coordination, we're going to ensure that the appointment was attended. So the components are pretty much the same. And you guys, one other thing I like about the Zoom, when we would encounter our families like at a pediatric practice or OB office or WIC, that family had no idea they were going to meet with us that day. We do a cold call on them. They're there to see WIC or the doctor. And so when I have these appointments with them, they're prepared for oral health. And it has been very satisfying. They go very well.
That's awesome, Lori. It sounds like the teledentistry is working really well for reaching a lot of this population, or at least some of the population, and you're getting a lot of great conversations going about oral health. But
we really are.
Yeah. Do you encounter any issues, maybe with connecting the mom to dental care or any other issues like that?
we have huge problems with connecting mommies with affordable dental care. And my supervisor, she was formerly a dental assistant for years. She worked at ASDO managing the dental assistants there. And so thank goodness for her, because she has created a lot of partnerships with dentists in the community that are doing charity care for us. And I have to give my hats off to her for doing this. Just this week, she was able to find an endodontist that performed 2 free root canals
Wow.
for this mother. And now she's looking for care to get the crowns done. And as you know, when we work with children, their dental needs could be a lot. But when we start to work with the adult population, their dental needs are complicated and complex between decay, cavities, and gum disease, periodontal disease. These can cost thousands of dollars in a mouth. So the barriers become much more increased in the adult population. And therefore, we need more charity care. And what we really need is we need a dental benefit within our Medicaid system called Access in Arizona. Now, our coalition that we're here with today is doing a wonderful job of helping us with that. Our Dental Hygiene Association is, the Dental Association is, March of Dimes is helping us. We need more helpers. We need more organizations so that we can get this ball rolling. This has been through the legislature, I believe, at least 4 times and never gotten funded. So now the next person that I want to talk about as we kind of wrap up here, because this is my action item. We need resources, dental resources for our adult population. And for my program, that would be the Expectant Moms. We need help. So Deb Kappas is our chairperson of advocacy. Help me, ladies, say it. Within the Arizona Dental Hygiene Association. And she was able to give me some information that they're already starting to prepare for this. So our chairperson, Joan Osborne, is getting some select legislators together. They're considering an omnibus bill. Now, when you do an omnibus, that means there's other components within just our dental benefit. So they're starting to get their agenda ready for 2022. So what can we all do? First of all, what would we like? We would love a dental benefit for all needy Arizonans, period. If we can't get that, at least ensure our pregnancy population. I want you all to stay tuned and be alert to those call for actions that come from our associations. And the other thing is, when it's easy now, and our coalitions and our associations have made it a lot easier for us to find and connect with our legislators. And can I just tell you, coalition leaders and association leaders, please make it easy for us. Our days are busy just like yours are. If you give me a link and I can click, I will get it done. If I have to go in and research it, many of my friends don't take the time to do that. But the easier you can make it for us, we will do it. And I want my all my fellow friends out there, help us do that. And we need to advocate to other organizations and associations to join our cause, because the more there are of us, the squeaky wheel gets the grease. So, questions on advocacy, ladies?
I think you summed that up very well, Lori. Thank you so much, and for bringing up Osborne stakeholder meetings, and the adults Medicaid dental benefit is going to be a really major priority for the Arizona Oral Health Coalition, and I'm sure the Dental Hygiene Association this year as well. And so, like Lori said, the best way to stay kind of hooked into that is to sign up for the coalition newsletter, or if you are a hygienist, make sure to be on your professional organization's list to look out for those action alerts. And I'll definitely take that advice that you gave, Lori, back to our advocacy committee about making, engaging really simple and really easy. We're going to need all the support that we can this year. It's a big year, and there's actually some movement on the federal level as well for a Medicare dental benefit and a Medicaid dental benefit. The Medicare dental benefit has gotten a little further. It's actually been included in the infrastructure proposal. Medicaid, not as much. So we're still kind of working on that end, but this might be the year, as Lori said, at least on the pregnancy front, this has been a long time coming. And so we'll need all hands on deck.
Yes. Yeah, I agree. You guys, thank you so much for letting me talk about my passion, which is children and public health, and of course, these pregnant mommies. I really appreciate the time today, and we've got a lot of work to do.
Thank you so much, Lori. This has been so informative and wonderful. And I think this presentation in and of itself will be a great advocacy tool as we look forward to the next session.
Okay. Thank you, ladies.
Yes, thank you, Lori. All right, well, if anyone has any questions, definitely you can paste them in the comments on the Facebook video when this is inevitably posted. Even if it's a recording, you can comment and we'll make sure that your question gets to Lori. But other than that, I don't believe we have any questions at this moment. So thank you so much, Lori. It was great to hear about your passion. This is what we want to hear about in these webinars, and just wonderful work for those children and for pregnant people with the First Teeth First. So, all right. Well, thank you so much.
Yes. Thank you, guys, and have a wonderful weekend, everybody.
You as well. Thank you, everyone. See you next time. Bye.